Good evening. The husband of a Toronto woman diagnosed with COVID-19 has also tested positive. The news emerging today, making this Ontario's first confirmed local case of human-to-human transmission of the virus. Today, public health officials held a meeting as concerns grow about testing and surveillance in the province. The sixth case of COVID-19 confirmed in Ontario. A man in his 60s married to a woman who has tested positive herself. She had returned to Canada from Iran nearly 2 weeks ago, but she didn't visit a hospital for another 9 days.
People need to be tested for this.
Myra Marsh is calling for better screening. She's just returned from a trip overseas where she spent the better part of her time in Punta Cana in a hospital bed after developing a pneumonia-like cough and fever. Despite that, she wasn't screened when she arrived back in Canada, and her local health unit refused to test her because she didn't meet the criteria. So instead, she self-isolated at home.
Yes, I have all the symptoms of coronavirus. The one criteria that I don't meet, and I didn't travel to China. And I told her, I've been through an international airport twice. There's hundreds of thousands of people that go through that airport, and you're shoulder to shoulder with them. You know, I'm on a flight that's got 300 and some people. I don't know where they've been or who they've been in contact with. You know, this virus is, could be anywhere.
And it is. In the U.S. today, a California patient tested positive for the virus despite not traveling anywhere on the watch list. If somebody were to call a hospital and say, I have these symptoms, but I haven't traveled anywhere, would they be rejected from getting tested?
We're still leaving it to the physician's prerogative, the healthcare provider's prerogative to say, this seems normal, looks normal, I'm going to do the normal battery of tests.
Health officials were pressed at a media briefing today about why the province isn't ramping up surveillance and testing.
We moved ahead against the WHO, or not against, but ahead of the WHO, and added 7 areas of concern. We added those in. We're adding maybe more shortly.
They say their labs can conduct up to 1,000 tests a day, well above the current demand of only 40 to 50. And they say the risk to Ontarians remains low. They've also listed 7 countries of concern: China, Japan, Hong Kong, Italy, Iran, Singapore, and South Korea.